Plan the axial slices on the coronal plane, angling the planning block parallel to the medial and lateral condyle of the femur. Verify the planning block in the other two planes. Provide an appropriate angle in the sagittal plane perpendicular to the line of the femur and tibia. Ensure that the slices adequately cover the knee joint from the tibial tuberosity up to the superior border of the patella. The phase direction in the axial scans should be from right to left to minimize artifacts caused by popliteal artery pulsation. To further reduce arterial pulsation artifacts, consider using saturation bands above and below the axial block.
2. Stir sagittal. Plan the sagittal slices on the axial plane. Angle the planning block parallel to the lateral condyle of the femur, parallel to the anterior cruciate ligament. Check the planning block in the other two planes. An appropriate angle must be given in the coronal plane, parallel to the midline of the femur and tibia. Slices must be sufficient to cover the knee joint from right to left. The phase direction in the axial scans must be head to feet to avoid artifacts from popliteal artery pulsation. Using saturation bands above and below the sagittal block will further reduce arterial pulsation artifacts.
PD fat set coronal. Plan the coronal slices on the axial plane, angling the planning block parallel to the medial and lateral condyles of the femur. Check the planning block in the other two planes. An appropriate angle must be given in the sagittal plane, parallel to the midline of the femur and tibia. Slices should sufficiently cover the entire knee joint from anterior to posterior. The phase direction in the axial scans should be head to feet to minimize artifacts from popliteal artery pulsation. Utilizing saturation bands above and below the coronal block will further reduce arterial pulsation artifacts.
Common indications for MRI of the knee: meniscal disorders, non-displaced and displaced tears, discoid menisci, meniscal cysts, marrow abnormalities, avascular necrosis, marrow edema syndromes, and stress fractures. Congenital and developmental conditions: Blount disease, dysplasia, normal variant, synovial-based disorders, symptomatic plicae, synovitis, bursitis, and popliteocysts. Muscle and tendon disorders, strains, partial and complete tears, tendinitis, tendinopathy. Mechanical knee symptoms: catching, locking, snapping, crepitus. Vascular conditions: entrapment, aneurysm, stenosis, occlusion. Neoplasms of bone, joint, or soft tissue. Infections of bone, joint, or soft tissue. Ligament tears, cruciate, collateral, retinacular, osteochondral and articular cartilage infractions. Osteochondral fractures. Osteochondritis. Degenerative chondrosis, chondromalacia, acute trauma, fractures. Contraindications: any electrically, magnetically, or mechanically activated implant, such as cardiac pacemaker, insulin pump, biostimulator, neurostimulator, cochlear implant, and